were relocated to Nuffield Health in Newcastle-under-Lyme. This is an example of practical measures hospital trusts have been taking across the UK to limit the spread of coronavirus since the outbreak in March. As we approach the winter pressures on the NHS, can my right honourable friend outline to the House the precautions government is taking to ensure cancer patient treatments and appointments are not being put to the back of the queue or suffering from undue delays?
Yes, my honourable friend makes an important point, and the Royal Stoke Hospital has performed brilliantly during coronavirus, and I want to thank everybody who works there for the efforts that they've gone to. What I'd say is that it's critical for everybody to understand that the best way to keep cancer services running is to suppress the disease. And the more the disease is under control, the more that we can both recover and continue with cancer treatments. And it's beholden on all of us to make the case, I believe, that controlling this virus not only reduces the number of deaths directly from coronavirus, but also enables us as best as possible to recover the treatment that we need to for cancer and other killer diseases.
Angela Richards.
Thank you, Mr. Speaker. Following on from an online meeting with the manufacturer, I'm excited to be visiting the Royal Surrey Hospital on Friday to see up close the robotics that are used in many soft tissue cancer operations that have been taking place. Does my right honourable friend agree with me that these clever robots, operated by talented surgeons, help to reduce the size of the incision site, therefore trauma, meaning a swift discharge and recovery for cancer patients, and is crucial for the ongoing success in hospitals like the Royal Surrey, which is a world leader in cancer treatments?
Yes, I know the Royal Surrey, and I enjoyed visiting, albeit in the rain, in December last year with my honourable friend. And I would say that at the Royal Surrey, they're carrying out some of the most cutting-edge treatments for cancer. We've put extra funding in, an over £200 million fund for the use of advanced technology for treating diseases like cancer. And she will have seen that yesterday I also announced to the House that we are engaging with the best regulators around the world as we leave the European Union to make sure that we get cancer treatments to the front line as fast as is safely possible.
Thank you, Mr. Speaker. York Hospital experienced a fall in cancer referrals at the height of the pandemic, as a lot of other hospitals did, as a result of residents stopping to go and see and consult with their GP. There's real concern among health professionals in York about the knock-on consequences of this and the rise in the backlog that we're getting in cancer referrals locally. So what steps can the Secretary of State bring forward to make sure that they assist NHS trusts like York to assure that this backlog does not lead to late diagnosis cases worsening cancer outcomes going forward?
My honourable friend raises a very important point. As I mentioned in response to the first question, we now have referrals back up to over 80% of pre-pandemic levels, but we need to get that up further because we all know that early diagnosis saves lives. I'm also very glad to be able to report that in July, on the latest data, over 90% of patients saw a cancer specialist within 2 weeks of a referral from the GP, and 95% of patients received treatment within 31 days of a decision to treat. So those referrals are leading to the action that's necessary, and it's very important that the message goes out that the NHS is open and anybody with a concern over cancer should come forward and they can get the treatment in a safe way that can help to save their lives.
Shadow Minister Alex Norris.
Thank you, Mr. Speaker. At June's departmental questions, I pressed ministers on the cancer backlog that has grown so greatly under COVID. So it was alarming, Mr. Speaker, that despite those ministerial assurances that between August and September, with infection rates, of course, being much lower than they are today, the waiting list to see a specialist grew by 16%. Things will only get harder now infection rates are rising and with the NHS facing winter pressures. So will the Secretary of State give us a categorical assurance that he does have a cancer recovery plan and that this plan will drive down these waiting lists in each month for the rest of the year?
Yes, absolutely. I think we agree right across this House of the importance of this agenda. The first and most important part of it is to bear down on the long waits because, of course, the longer that you wait, the more dangerous cancer can become. That is happening. And as I say, we've also got to make sure we bring the referrals forward, because we don't want to have fewer people referred for the diagnostics. And then at the same time as that, we are expanding the diagnostics that are available, both in hospitals and increasingly in community hubs, which are both safer from a COVID point of view, and for the long term will mean that diagnostic centres for things like cancer can be perhaps on a high street or in the places where people live, and you don't necessarily have to go to a big acute hospital in order to get the diagnostics part of the pathway done.
Dr. Johnson.
Thank you, Mr. Speaker. Number 7, please.
Thank you, Mr. Speaker. It is vitally important that non-COVID treatments are restored as quickly and safely as possible. That is what the NHS is doing. By October, the NHS is working to have that up to around 90% restored to last year's levels.
Dr. Johnson.
Thank you, Mr. Speaker. Mr. Speaker, thankfully children are relatively robust in the face of coronavirus. However, children's services, like other hospital services, were reduced during the pandemic, quite understandably. What is my right honourable friend doing to ensure that paediatric services are now 100% up and running and not affected by a future wave of the pandemic? And what is he doing to support NHS trusts in dealing with the backlog of appointments delayed by the coronavirus?
Thank you. Well, I pay tribute to my honourable friend, Mr. Speaker, for her service to her constituents, both as their MP but as a paediatric clinician. She's right to raise this important issue. Restoration guidance has already been published by NHS England and Improvement, setting out a framework to fully restore services in this area, which I agree with her is vitally important. I'd be very happy to meet with her to discuss this further.
Abena Pogdasari.
Thank you, Mr. Speaker. Number 8, please.
Thank you, Mr. Speaker. We are working closely with the Department for Education to support children and young people's mental health, and we remain committed to implementing the proposals of the Children and Young People's Mental Health Green Paper, putting mental health support teams into schools and colleges, otherwise known as Trailblazer schemes.
Abena Pogdasari.
Thank you, Mr. Speaker. School children have had their educations interrupted. They've been separated from their friends and face continual threats to their daily lives. The government knew schools were to return. Why did the government not put adequate measures to provide mental health provision in schools for students and teachers?
Well, Mr. Speaker, I'm afraid I have to say that actually the opposite is the case. We have just completed the Wellbeing for Education Reform Train the Trainer scheme, which the trainers are being trained by the Anna Freud Institute and ready to go out into schools across the country. It was always the position that schools should be open and the best place for children to receive help and support for exactly the reasons that she described: separation from their routine, from their friends, and school being a place of safety. The Train the Trainer is now completed. My honourable friend for Chelmsford and I have worked hard on this over the summer to make sure that £8 million was there, that training was in place, ready to provide both mental health and wellbeing support to children when they return back to school. And I'm pleased to say that the last Train the Trainer scheme happened last week, and they are now ready to move into schools across the country.
Now come to Shadow Minister, Dr. Lasenda Allen Khan.
Thank you, Mr. Speaker. It has been 6 months of uncertainty for our country's children and their parents. Schooling cancelled, the exam results fiasco, and now students trapped in uncertainty in their university accommodation. Despite the Education Secretary recognising there was a serious impact on young people's mental health, yet again it seems this government has no plan. Children and young people are being failed. When will the Minister finally address the pending mental health crisis in our schools, colleges and universities?
Oh, Mr. Speaker, I just do not recognise the picture that the Honourable Lady has presented. We are investing at least £2.3 billion in mental health support and mental health provision. This investment actually translates to 345,000 children and young people who will be able to access mental health support via NHS-funded health services and school-based mental health support teams. Spending on children and young people's mental health service is growing faster than the overall spend on mental health, which itself is growing faster than the overall budget in the NHS. Children and young people's mental health is our priority, and we are doing that by investing in it, and the picture she paints, I'm afraid, is completely not the case.
We now come to Helen Hayes.
Question 10, Mr. Speaker.
Minister.
With your permission, Mr. Speaker, I will answer question 10 together with question 11, 12 and 13. NHS Test and Trace launched in May. 4 months later, over 150,000 people who've tested positive for COVID-19 have been contacted, and 450,000 of their contacts have been reached so they can self-isolate. We have tested over 7 million people at least once, and many, like care home workers, more than once. Rapid expansion does bring with it challenges. Working with local authorities, we will continue to improve test and trace, as it is an important part of our armoury to defeat this virus.
Thank you, Mr. Speaker. As a co-chair of the APPG on adult social care, I meet weekly with a working group drawn from across the care sector. Providers on this group report that they are still experiencing delays in receiving weekly test results, still have no routine access to weekly testing for domiciliary care workers or staff working in supported living environments, and urgently need regular testing for family members to alleviate the terrible isolation of care home residents from their loved ones. When will the care sector have all of the access to testing it needs on a reliable basis to stop the second wave of coronavirus from delivering the utter tragedy and devastation of the first to the care sector?
I thank the Honourable Member for her question and also the work she does with the APPG, which I joined recently, for a very valuable conversation. Supporting care homes through the pandemic and in the months ahead is absolutely our and my priority. One part of that is making sure that they have the testing they need. We are getting regular repeat testing to care homes. I acknowledge that the turnaround times have not been what we would have liked them to be, but those turnaround times are coming down and we're seeing a rapid improvement in the performance.
Thank you, Mr. Speaker. This week, the President of the Association of Directors of Public Health said that the funding is just not there for local authorities to effectively run local contact tracing. Where this has been done at the cost to the local authority, evidence showed that local teams were more likely to be successful in contacting people compared to the national tier 2 and 3. Can the Minister tell me why the government keeps insisting that the current track and trace system is working when public health professionals are telling them the opposite?
I thank the Honourable Member for her question. I'm sure she will know that local authorities received £400 million to support them with local outbreak management, and also that we know actually it is really important where we have the coming together, the national system with the local system, and where local authorities are indeed playing an important part using their local knowledge to follow up with contact tracing, particularly some of the contacts who are proving harder to reach.
Heading up to Old East with Carl Turner. Carl Turner.
Thank you, Mr. Speaker. Schools in my constituency of East Hull are having to close, disrupting children's education and the work of their parents. Serco Test and Trace has been an unmitigated disaster. It's more than an extraordinary waste of public money. It's a public health crisis. And to make matters worse, ministers signed off on a wholly inappropriate Excel spreadsheet, blowing billions and leaving thousands of contacts untraced. When I asked the Secretary of State last week when he was going to take personal responsibility, he simply boasted that the system was working brilliantly. When does she think her boss, the Secretary of State, will begin to take personal responsibility for this fiasco?
Minister.
Thank you, Mr. Speaker. Well, there was quite a lot in that question. One thing I will say on schools is that very much part of the whole strategy that we are using to tackle and suppress coronavirus is indeed to enable our children to continue to go to school, because education is so important. To the point on the specific test and trace system and the issue to which he refers to, in fact, the Secretary of State spent an hour and a half in this chamber yesterday answering people's colleagues' questions about the performance of that system.
Rachel Maskell.
Thank you, Mr. Speaker. In the light that infection levels in York have risen from 63.1 cases per 100,000 to 143.9 cases per 100,000 in just the last 7 days, local public health team is working with the university and local labs, and together they put together a programme where they can process the testing and do contact tracing, a testing service which works for York, test results the next day and tracers who understand local population flows. Will she enable them to do their work and this to happen and put the resources necessary in place? This surely is the game changer we need to beat this virus.
Minister.
Thank you, Mr. Speaker. Well, it's very good to hear of the setup that she describes in York. And what I can do is take away from here to follow up and make sure that there is the joint working, which we know is a really effective way of bringing together the national resources and the local resources and expertise and the local knowledge, which is so important in tackling this virus.
Heading up to Scotland with the first of two questions, SNP spokesperson Dr. Philippa Whitford.
Thank you very much, Mr. Speaker. With COVID, speed is of the essence, but people are struggling to get a test due to limited capacity at the Lighthouse labs. New labs were due to open in Newport in August and Loughborough last month, but both are delayed. As NHS labs are having to take on more testing, can the Minister say what additional funding will be provided specifically to increase NHS lab capacity?
Minister Wakely.
Thank you, Mr. Speaker. The context to this is the huge increase in the testing capacity of our system that we've already seen, going from in the order of 2,000 tests a day back in March to now well over 200,000 tests a day, and building up to 500,000 tests by the end of this month. I recognise also that there is both the Lighthouse Labs, what's known as Pillar 2 testing system, and the important part that NHS testing facilities play in the pandemic. And of course she will know that a huge amount of money has been and is going to the NHS to support their response to COVID.
Dr. Philippa Whitford.
Scotland's public health-based tracing service has reached over 95% of contacts, yet 4 months on, the Serco system in England has still only reached 61%. As finding contacts and getting them to isolate is critical to reducing COVID spread, shouldn't tracing in England now be based more on local public health teams?
Minister.
Thank you, Mr. Speaker. What may be helpful to say is that since the NHS test and trace system started, it has contacted 78.5% of those who have tested positive, and then 77% of their contacts have been reached. And there is this important part of the system where you have both the national contact tracers and then the handing over to local authority contact tracers who are able to access the same system and supported in doing contact tracing, but critically using also the local knowledge of the local area to increase the success rate, because it is really important that people are reached wherever possible and advised to self-isolate. And while I'm answering this question, can I also say how much I appreciate and thank all those who are doing the right thing and who are self-isolating, those with symptoms, but also those who are being contacted by contact tracers.
The Minister Justin Manners.
Thank you, Mr. Speaker. I'm not going to ask about the current problems with test and trace, because it's clear what we've heard already. The government have no answers on that. Instead, I want to ask about the so-called moonshot tests and Dido Harding's comments that some people will have to pay for them, because when the Prime Minister was given the chance a fortnight ago in here to deny that was on the table, he didn't take it. We have real concerns about creating a two-tier system for tests where some people have to pay. It undermines a fundamental principle of the NHS and will do nothing to stop the spread of the virus. So will the Minister give us a definitive answer today? Are some people going to have to pay to access the moonshot tests? Yes or no?
Thank you, Mr. Speaker. I don't recognise the comments that he's making about the suggestion that there should be a two-tier system. What we have in place is a universal system where everybody who has symptoms is able to access a test, and as he will well know, where we know that we have particular risks, like for those in care home settings, that there are also tests for those who don't have symptoms, so we can pick up outbreaks early on. And a huge amount of resource and investment is going into developing new technologies for testing, easier testing, quicker tests, and tests that can be done at greater scale, because this is all part of building up our testing capacity so we can suppress this horrid virus.
Ms. Loader.
Question 17, Mr. Speaker.
Minister Waitley.
Thank you, Mr. Speaker. Education, health and care plans identify the support needs of children and young people across those three areas. Local authorities and health bodies are required to jointly commission the services. The government is currently undertaking a review of the SEND system, and I'm working with my ministerial counterpart in the Department for Education on this.
Can I first of all thank the Secretary of State and Ministers for their focus to Dorset County Hospital in the recent investment announcements. But in my West Dorset constituency, I have totally unacceptable waiting times for EHCPs for children and their parents of up to 2 years. It's totally unacceptable. They face the most difficult of situations, and I'm afraid are losing hope. Will the Minister help me in supporting these desperate children and parents who need to get their CHP plans done? Thank you.
Minister.
My honourable friend makes a really important point about how we need to see children and young people getting the support in place that can help them as soon as possible, and that there are waiting times for these plans. There's two things I can say to him in response. One is in the context of COVID, that NHS England has made it clear to NHS organisations that they must restart and restore the services that support children and young people with EHC plans and the assessments for those plans. I will also say in the review of the SEND system that I mentioned in my earlier answer, we are indeed looking at how we can address some of the problems in the system and achieve better integration across health, care and education.
Kim Johnson.
Question 18, Mr. Speaker.
Minister Churchill.
Thank you, Mr. Speaker. Women at greatest risk of breast cancer continue to be prioritised for screening. The NHS has worked hard and significantly reduced the backlog of delayed breast screening appointments from over 468,000 in June to under 52,000 in September. All services have now been restarted, and in this Breast Cancer Awareness Month, the message is clear. When you get a screening invite, please attend, and if you're worried about anything, contact your general practitioner.
Kim Johnson.
Thank you, Mr. Speaker. Breast screening appointments were paused during the height of the pandemic. Breast Cancer Now has estimated that 986,000 women across the UK miss their mammograms, and they estimate that as a result there could be 8,600 women living with undetected breast cancer. With it being Breast Cancer Awareness Month, what steps is the Secretary of State taking to address the gaps in specialist breast cancer nurses recently highlighted by Macmillan Cancer Support? Thank you.
Minister.
So I thank the Honourable Lady for her question. Cancer nurse specialists are a particular interest of mine, and in the long-term plan it identifies that everybody deserves to have personalised care from a cancer nurse specialist. We did see rates decline from 2018, where they were 91%, to around 89% in 2019, and we are focused on making sure that everybody has a cancer nurse specialist. We promised in the long-term plan, and it's our ambition to deliver that personalised care to every woman. And as I've outlined, the backlog of breast cancer screening has gone down, but I would once again urge women, if they are called for a screen, to come forward. It is safe, and you never know. Like me, it could make all the difference.
We have a substantive question to Secretary Hancock. Hello.
Thank you very much, Mr. Speaker. With your permission, I'll answer questions 19, 20 and 21 together. I chair the Government's Local Action Gold Committee, which considers the latest data and advice from experts, including epidemiologists and the Chief Medical Officer and the JBC. And we consult through this process with local leaders and directors of public health. We've seen local actions in some part of the country bring the case rate right down, and we need to make sure we are constantly vigilant to the needs of what needs to happen to suppress this virus.
Heading up to Sefton with Bill Esterson. Bill Esterson.
Yesterday, the Health Secretary told me we have been putting that money into councils. What money's that? £7 million, he announced, split between 9 councils. That's against 12 billion for Serco. That's not putting that extra money into councils, is it? So can I ask him to show respect for members of this House, and more importantly for our constituents, and answer the question, when is he going to stop relying on the outsourcing giants and support local public health teams with the funds they need, because that's how he and this country is going to fix, test, trace and isolate.
Secretary of State.
Thank you very much, Mr. Speaker. Well, we are, as he said in his question, we are putting money into local councils in areas where there's local action that needs to be taken. And we have an open dialogue with councils and with local mayors about what needs to be done. But I would just urge him that on behalf of all of his constituents in Sefton, that I think it's better to support the whole effort to control this virus, not just part of it.
Wyn Thompson.
Thank you, Mr. Speaker. The Mayor of London has warned that the virus is now spreading widely again across London, although vital knowledge is being hampered by the problems with test and trace. Is the government now looking at introducing wider restrictions across London, and will the Cabinet Secretary, as a matter of interest for this House, as a part of that, commit to introducing a commitment for a reintroduction of a hybrid parliament in such a situation?
Secretary.
Mr. Speaker, well, I discuss these matters with the Cabinet Secretary and other colleagues across government all of the time. I also speak regularly to the Mayor of London, and we maintain vigilance over the transmission of the virus right across the country.
Judith Cummins.
Thank you, Mr. Speaker. Can the Secretary of State answer a very simple question? What is the rate of infection, which means a local authority needs to go into local restrictions, and what is the rate which means it can leave them? Now, of course, I accept that there will sometimes be very specific circumstances, such as workplace outbreaks, that would need to be considered, but surely it is not beyond his level of competence to do both, because, Secretary of State, my constituents deserve to know when they can see their families.
Well, of course, her constituents and all those who are under local action restrictions, of course they yearn to see their families and to be able to, we all yearn to be able to get back to the normal sort of socialising that makes life worth living. But I'm afraid the answer to her question is in the question, which is that because of specific local circumstances, like workplace outbreaks or halls of residence outbreaks, it isn't possible to put a specific number on the point at which a judgment is made, both to put in place local restrictions, where we do that in consultation with the council, or indeed to take an area out.
Greenwood.
Number 22, Mr. Speaker.
Mr. Whitman.
Thank you, Mr. Speaker. Universities have a duty of care to support students required to self-isolate. The Department for Education is working with universities to make sure that where an outbreak occurs, this support is in place. This includes ensuring students with cystic fibrosis or other long-term health conditions who are self-isolating have access to food, medicine and the medical care they may need.
Greenwood.
Self-isolating students across the country and their understandably worried parents are reporting problems accessing food, drinks, exercise and other support. Now that's completely unacceptable for any student, but for those with cystic fibrosis who often have high calorie requirements in order to stay well, access to regular food supplies is absolutely essential for their health. What's she doing to ensure that students with CF who are required to self-isolate at university and have previously shielded are able to access priority supermarket delivery slots, as many will have relied on their parents' accounts when they were at home? And what other action is she taking in partnership with universities and education to ensure that every student with CF who finds themselves in lockdown are supported with their healthcare needs?
Minister.
Thank you, Mr. Speaker. And she asks a really important question. And clearly, it is a difficult time for students starting university now, but particularly those with long-term health conditions like cystic fibrosis. Overall, she knows the context is that we are prioritising education and we don't want students to put life on hold, but we do want them to be supported by their university, and particularly if it is harder for them to self-isolate because of health conditions. I'm in regular contact with the university's minister. I will take up specifically the question about the support for students with cystic fibrosis and the access to supermarket deliveries. I'd also ask her if she has any specific case that she would like to raise with me to let me know, and I'll also take that up with the university's minister to address the specific issue. Thank you.
Gordon Henderson.
Number 23, Mr. Speaker.
Secretary Hancock.
Thank you very much, Mr. Speaker. As part of the drive towards the target of 500,000 tests a day of capacity by the end of October, we have announced additional lighthouse labs as part of the National Lab Network, and work is ongoing to expand the UK's lab capacity inside the NHS also.
Thank you, Mr. Speaker. The lighthouse labs don't appear to be actually delivering sufficient test results. Schools and care homes in my constituency are still having to wait unacceptably long time for COVID-19 test results, and those delays are making it difficult for them to operate properly. So what is my right honourable friend doing to make better use of the many life science companies in Kent, including those on Discovery Park in Sandwich and the Kent Science Park in my own constituency of Sittingbourne and Sheppey? Those companies have laboratories in which some of the tests taken in Kent could be analysed.
Yes, we're increasingly contracting with labs like the ones that he mentions, as well as the lighthouse labs, which have the huge capacity, to make sure that we can both increase capacity and also reduce the turnaround time. And I'm glad to say that in the last week, the latest figures showed that the turnaround time is coming down, which I'm sure is important in Kent and right across the country.
We now come to the substantive question to Minister Doris.
Thank you, Mr. Speaker. As I said in my earlier answer to the Honourable Lady on the front bench, we are committed to spending on children and young people's mental health services, which are growing faster than the overall spend on mental health, and to this overall spending itself is growing faster than the NHS budget.
Let's head to one spec with Ian Lavery. Ian Lavery.
Thank you, Mr. Speaker. See, hear, respond. A new service managed by Barnardo's in response to COVID-19 to provide early intervention support for families, children in crisis has received over 11,000 referrals since June. The majority of children and young people referred need support for their mental health and well-being. Can the Minister say what early intervention measures have been introduced? Are they enough? And does she agree that these early intervention measures are key to tackling the increase in children and young people's mental health and well-being needs?
Mr. Speaker, I couldn't agree with the Honourable Gentleman more, and the Government's £8 million Wellbeing for Education Reform programme, which is to support staff to respond to the emotional and mental health and the wellbeing pressures that some children have experienced during the pandemic, is in place. And as I said previously, the last Train the Trainer session happened last week, and those trainers are ready to go into schools, into primary schools, to assist both teachers and parents in recognising when children display early signs of emotional distress or mental health issues as a result of the pandemic. And as I said before, I've been working closely with my honourable friend from Chelmsford in the Department for Education to ensure that this programme is in place to address exactly those needs that he's highlighted.
Right, we now go to Alistair Carmichael.
Number 25.
Minister Churchill.
Thank you, Mr. Speaker. I'm sure the Right Honourable Gentleman would welcome yesterday's announcement that NICE and the Scottish Intercollegiate Guidelines Network will work with the Royal College of General Practitioners to develop guidelines to support patients and practitioners in their treatment and recovery of this disease. This follows on from the NHS launch in July of the Your COVID Recovery Service, which provides personalised support for individuals. In addition, we're funding research into COVID-19, including a study of 10,000 patients who were admitted to hospital with COVID, building our understanding of the long-term effects and helping direct those improved treatments that are needed.
The Minister for that very helpful and comprehensive answer. If she has not already done so, could I commend to her the most recent edition of The Doctor, the BMA magazine, which outlines several compelling case studies of GPs who are still suffering, some up to 6 months after they first contracted COVID. There is this growing body of evidence that a number of people continue to suffer with this months after it's been contracted in a quite debilitating way. Will she build on the work that she's already doing and make the case to Treasury and DWP in particular to ensure that all those who suffer from long COVID get the support that's necessary for them?
Mr. Churchill.
I'd like to thank the Right Honourable Gentleman for that statement, and I will read that document with interest. It is a new disease on which we're still gathering evidence and data so that we know how we can best support the individual in their recovery and arguably their new COVID-tinged life. So I will assure him that that is precisely what I will be doing, looking at the evidence base and making sure we're working with the colleges and general practitioners to make sure that we get the right answers.
Sarah Dines.
Thank you, Mr. Speaker. I've been contacted by, well, substantive question 26 first, sorry.
Minister.
Thank you, Mr. Speaker. And with your permission, I will take this question and questions 27, 28 and 29 together. Mr. Speaker, we have sweated blood and tears to support the sector through this pandemic. And last month, we launched the Adult Social Care Winter Plan with regular testing for care home staff and residents, free PPE and mandatory infection prevention and control measures for care providers, supported by 546 million government funding. I am enormously grateful to all those at the front line in social care. I recognise the challenges they have faced and how many feel daunted by the winter ahead. And I say to care workers, I cannot thank you enough for what you do, and I'm with you every step of the way.
Sarah Dines.
Thank you, Mr. Speaker. I've been contacted by Anne Penrose, who is 91, in good health, in a care home in Ashbourne, Derbyshire Dales. She asked her family to contact Boris, but sadly she got me. Will the Minister agree that the time has come to look very carefully at what's happening in care homes, to review the existing measures and routines and guidelines, bearing in mind that we're testing so much now, and we need to have a bit more humanity. We're in danger of throwing the baby out with the bathwater. These people need their families, yes, in a safe environment, but they do need to have access to families and at times their pets.
Minister.
My honourable friend makes a really important point about the importance of visiting to those who are living in care homes, both for the individuals themselves in the care homes and for their family and friends who want to visit. And this has been one of the hardest areas over the last few months to get this right and to get the balance right between protecting care home residents from the risk that COVID might be brought into the care home where it is so hard to control, while giving them access to visitors. That's why in the summer we issue guidance on safe visiting and giving more freedom on the decisions about visiting to local authorities, directors of public health, working with care homes. And I want us to continue to support and enable safe visiting for care homes.
Can I just say to the Minister, I've got a group set of questions I'm going to have to run through. It's going to take us well into topical time. She really does need to speed up on the answers. Fiona Brim.
Thank you, Mr. Speaker. Can I thank the Minister for the Social Care Winter Plan announced 2 weeks ago? And can she tell me when this £500 million infection control fund will be released to councils covering constituencies like mine of Congleton to help protect residents and staff over the winter?
Minister.
Thank you, Mr. Speaker. So the Infection Control Fund is being distributed in 2 equal instalments. The first of those instalments has already been paid to local authorities. Her local authority, Cheshire East, will be receiving 4.7 million in total, so it should already have had 2.35 million to go towards the extra costs for care providers and others in infection prevention control.
Scott Mann.
Thank you, Mr. Speaker. As always, I'd like to commend the Department and the Secretary of State for the work during the pandemic. Although not every part of the response has been perfect, and we never expected it would be, I'm convinced that the Department has done its utmost to protect the public. I do have some concerns, however, about the transmission between care homes. What measures has the Department taken to prevent cross-contamination of COVID between care homes, particularly from staff that work in multiple locations?
Minister.
I thank my honourable friend for his comments, but I should also say most of the credit should go to those working in social care themselves, who have been looking after some of the most vulnerable people in our society in such difficult circumstances. He is right, it's really important that we make sure there isn't transmission between one care home and another. That is why we are requiring care homes to make sure that their staff do only work in one setting and providing additional funding to enable them to do this.
Thank you, Mr. Speaker. Care homes are rightly the focus of our attention at the current time, but I know the Minister is reviewing the future of social care, and I wonder if she agrees with me that our focus there should be on more community-based services, not just solely on residential provision. And will she set my mind at ease by ruling out the creation of a new national care service run from Whitehall?
Minister.
Well, firstly, can I congratulate my honourable friend on his recent report on levelling up our communities. He has just said that care homes have indeed been the focus of our social care response to the pandemic, but I wouldn't want anyone to think that was the limit of our support for social care during the pandemic. The winter plan also includes support for domiciliary care, supported living and others. And I agree with him, as we look to the future, we should support the aspiration that most people have to live independently with their own front door well into their old age, and there are no plans to create a national care service run from Whitehall.
Shadow Minister Liz Campbell.
Thank you, Mr. Speaker. Families with loved ones in care homes are desperate to start visiting again, but are banned from doing so in swathes of the country with extra restrictions. Now, the government's own carers advisory group says visits are essential for residents' health, and that to make them safe, relatives should be treated like key workers with regular testing. So please, will the Minister now put that testing in place and lift the blanket ban on care home visits in lockdown areas so we help bring all families back together again?
Well, the honourable member makes an important point, as did my honourable friend a moment ago, about the importance of visiting for those in care homes and their relatives and loved ones. We are doing striking the balance, this very difficult balance between protecting those in care homes and making sure that wherever it's possible that they should have visits, but it must be done safely. I have heard indeed from the sector about the aspiration for some family members to be treated as care workers, for instance, if they visit their care home regularly. And as we expand testing, I very much intend to, and am making the case that I would like us to be able to test some visitors, but as I say, it's all part of how we can expand and use our testing resources.
We now come to topical questions. Secretary of State for Health and Social Care. I call Secretary Hancock to make a statement on his responsibilities. I will then call Tony Antoniazzi to ask the supplementary.
Mr. Speaker, on Friday we confirmed the 40 hospitals we'll build by 2030 as part of a package worth £3.7 billion, with a further 8 new schemes also invited to bid, all to ensure that we protect the NHS long into the future.
Tonya Antoniazzi in the goer. Tonya.
Mr. Speaker, all I want from the Secretary of State today is a simple yes or no answer. It's come to light that the Northern Ireland authorities have taken unprecedented action and committed to pay for private prescriptions for medical cannabis for severely ill children. Now, will he do the right thing and follow the example set in Northern Ireland in supporting other children with intractable epilepsy by paying for their private prescriptions? Yes or no?
Well, Mr. Speaker, the Honourable Lady's been a long campaigner on this subject. and we have made significant progress in terms of expanding access where that is clinically safe to do so. And I will, on this, as on so many things, make sure that I constantly follow the clinical evidence.
Jeremy Hunt,
Thank you, Mr. Speaker. My right honourable friend knows that for every person who tragically dies from coronavirus, at least one other person has long-term symptoms lasting more than 3 months, meaning that they have breathlessness, chronic fatigue, often can't go back to work normally. In his letter to me of the 14th of September, he said that clinics were going to be set up so they could get mental health support, face-to-face counselling, rehabilitation. Could he tell me, have those clinics been commissioned, and when will those long COVID sufferers be able to access them throughout the country?
Secretary of State.
My right honourable friend makes an incredibly important point, and I know very well the impact of long COVID, and it's something that I understand deeply. We are setting up those clinics. We're in the process of doing so, and there'll be further information on this very shortly.
Secretary of State Jonathan Ashworth.
Thank you, Mr. Speaker. Given the ONS today has said deaths have increased 3 weeks in a row, and given rising prevalence of the virus, can he understand the upset and the anger over the Excel spreadsheet blunder? And can he tell us today what he couldn't tell us yesterday? Of the 48,000 contacts, not the index cases, the contacts, how many have been traced and how many are now isolating?
Secretary of State.
Well, we have obviously been continuing to contact both the index cases and the contacts. Of course, the total number of contacts depends on how many contacts each index case has. So that information will of course, be made available in the normal way when that has been completed. But you can't know in advance how many contacts there are because you have to do the interviews with the index cases first.
Jonathan Ashworth.
There are thousands of people who have been exposed to the virus who could be wandering around, not knowing they've been exposed and could be infecting people, and he cannot even tell us if they've been traced. Can I move on to something else? I listened carefully to what he said about a vaccine yesterday in light of the news that the government is aiming to vaccinate around 30 million people. That's just under 50% of the population. Can I put it to him, there has been an expectation that the whole of the population would be vaccinated, not least because he said at the Downing Street press conference that I would hope, given the scale of the crisis, we would have a vaccine and everybody would have the vaccine. They're his words. So can he tell us, if we accept clinical guidance, but can he tell us, for the 50% of people who will not be vaccinated, how soon will it take for life to return to normal for them?
Secretary of State.
Well, as he well knows, decisions on the distribution of any vaccine have not been taken. The Joint Committee on Vaccinations and Immunisations are the body that advises the government on the appropriate clinical prioritisation of vaccines. They have published an interim guide, which he well knows about and we've discussed, and that sets out the order of priority as an interim, but we await the data from the clinical trials of the vaccine before we'll come to a clinically validated full rollout plan. We're putting in place the logistical plans now, but the decisions as to the clinical order of priority is one on which we'll take that evidence from the Joint Committee.
Can I just say to both front benches, these are meant to be short and punchy topical questions, not full debates. Joe Gideon.
Thank you, Mr. Speaker. With many GP surgeries adapting to coronavirus guidelines by holding surgeries outside, often in car parks, one of my constituents was left feeling embarrassed and upset, having to discover a sensitive and personal health issue within earshot of other patients waiting in line. Does my right honourable friend agree that in times where alternative methods are replacing the usual privacy of face-to-face appointments behind closed doors, GP surgeries must be sensitive to the whereabouts and comfort of their patients to ensure others do not have the same experience as my constituent?
Secretary of State.
Yes, Mr. Speaker, I wholeheartedly agree with my honourable friend who speaks well for her constituent. I'm very sorry that her constituent had that experience, and of course GPs should be sensitive, as the large majority are.
Glenn Fletcher.
Thank you, Mr. Speaker. The implications of coronavirus include rising levels of loneliness, which can impact mental health and physical well-being while increasing pressure on the NHS. Last Friday, I visited Henley Green Community Centre in my constituency of Coventry North East and saw the work they're doing with health services to combat loneliness and deliver positive health and well-being outcomes. What resources can the government provide to accelerate the spread of such social prescribing schemes so community groups can deliver tailored local support to tackle this growing problem?
I pay tribute to the group that she mentions. I've put a huge amount of effort into supporting social prescribing, including with funding, and I would encourage her CCG to engage with bodies like this to make sure that we can get funding to support them on the front line.
Dr. Caroline Johnson.
Thank you, Mr. Speaker. Mr. Speaker, at the start of this pandemic, in the first lockdown, abortion services were relaxed to allow women to enable them to access the service from home. But I'm particularly worried about the effect that this has had on those women who are particularly vulnerable, subject to abuse or in coercive relationships. Now that we know that the risk to women of childbearing age from attending a face-to-face appointment is extremely low, what assessment has my right honourable friend made of the ongoing need to continue in this way?
My honourable friend, the Care Minister, has committed to consult on this subject to make sure we get to the right outcome.
Heading up to Edmonton with Kate Osmore. Kate Osmore.
Thank you, Mr. Speaker. This government has repeatedly refused to meet with the group representing COVID-19 bereaved families. I met the group last week and they confirmed that they are not in litigation with the government and never have been. They simply want to put across the concerns of thousands of people who have lost loved ones to the coronavirus. So will the Minister now commit to meeting with the group and hearing their concerns firsthand?
Mr. Speaker, of course I have met and I continue to meet the families of those bereaved through coronavirus. This particular group, I'm afraid, when I last looked into it, they were in legal action, in pre-action protocol with the government, and therefore I'm advised that I shouldn't therefore meet them.
Simon Clark.
Thank you, Mr. Speaker. It's important that communities like mine in Middlesbrough can see a way out of tighter local restrictions that have now been imposed. Notwithstanding his earlier very reasonable answer to the Honourable Lady for Bradford South about the impossibility of setting hard metrics for the release from lockdown, can he set out what would constitute a path out, including, for example, a sustained fall in transmission rates?
Yes, Mr. Speaker, the level of cases matters, but so too does the direction of travel. And when the number of cases is falling, and especially if it's falling rapidly, that is the sort of indicator that we will look at. And one example is the action that we took in Leicester a few months ago now, where we removed some of the most restrictive measures when the numbers were coming down sharply.
Returning to one's bet with Ian Lavery. Ian Lavery.
Thank you, Mr. Speaker. Please, Secretary of State, my constituents need extra support. Despite the outstanding efforts of the staff at Northumberland County Council, COVID-19 is running rife through our towns and villages. And since stricter local lockdown measures were introduced, we've seen a huge increase in transmission levels. As parts of Ashington, Bedlington, Morpeth and Newbiggin seeing rates of almost 500 per 100,000. Secretary of State, please help us.
Mr. Speaker, I am very worried about the rates of transmission in the North East, as I am in parts of the northwest of England, and I look forward to working with him and with colleagues from across the regions affected to take the action that's necessary to suppress this virus and to support the economy and education and the NHS right across this land.
Suzanne Webb.
Thank you, Mr. Speaker. I have first-hand experience of how effective the app has been keeping my father COVID-free before he goes into hospital tomorrow. Could my right honourable friend update the House on the success of the app and advise me what more colleagues in this House can do to ensure the COVID-19 app continues to keep us all safe and my father?
Yes, the COVID-19 app has now been successfully downloaded by around 15 million people, including her father, and every extra person who downloads it helps to keep themselves safe and keep others safe. So everybody in this House, I would urge you to download it. I hope you have, Mr. Speaker, and I would, and it is one of the tools of the armoury of everybody, and everybody can play their part in keeping this virus as under control by downloading the app.
Jamie Sill.
Mr. Speaker, as you can imagine, I was astounded to be told that people living in Devon were being advised to go to Inverness for a COVID test. Can the Secretary of State reassure me that there is a truly collaborative effort being made by Her Majesty's Government and the Scottish Government to beat this virus?
Yes, absolutely. The testing facilities are one example of this, where the UK testing facilities right across the whole of the UK work very closely with the Scottish NHS, for instance, to make sure that people can get a test as close to them as possible. I think we have reduced the problem of people being sent to Inverness, but we continue to work to increase the capacity in Inverness and right across the country.
Andrew Percy.
Thank you, Mr. Speaker. Partly in response to very large queues and hours-long waits for tests in Canada, Health Canada has followed the US FDA in approving rapid testing, such as the ID Now test, which can give a result in 15 minutes. Can the Secretary of State update us on where we are with the rollout of rapid testing?
Yes, we're making good progress, both in validating the tests and in what needs to be done to be able to use them effectively. I've seen some of these reports from around the world, and I talk regularly to my opposite numbers about how we can get this sort of next generation testing going.
Jessica Borden.
Thank you, Mr. Speaker. With Spina Bifida Awareness Week coming up, can ministers say when the government will respond to the consultation on putting folic acid into flour? It's a move that could help reduce the number of babies born with birth defects of the spine, and it'd be important to hear when that might happen.
Yes, I'm a strong supporter of the work that we've done to look at this approach, and she's right to raise it, and I will write to her with a timetable for that response.
We're heading up to Greater Manchester with Mary Robinson. Mary Robinson.
Thank you, Mr. Speaker. Positive outcomes are more likely where cancer is detected early through breast screening, and evidence suggests that take-up of screening is generally higher when mobile units are used. Yet women in Heald Green have missed out on local screening and been directed out of Cheadle to Macclesfield. It's the second time that their 3-year-round checks have been disrupted, potentially affecting uptake and risking cancers going undetected. Would the Minister agree to meet with me to discuss ways to address the situation in Stockport and give women in my constituency the access to the local mobile screening units they need?
Yes, of course I would. Mr. Speaker, I just underline some news that my colleague, the Secretary of State for Minister for Primary Care announced, which is that the breast screening backlog from the first peak, which was 450,000, is now down to just over 50,000. I want to pay tribute to the NHS and all those involved in screening who've done so much work to bring this backlog down, and I'm absolutely very happy to meet my honourable friend on this subject.
Patrick Grady.
Thank you, Mr. Speaker. The pharmaceutical industry has highlighted supply difficulties due to COVID-19 as a challenge to recreating stockpiles before the end of EU transition in December. So how will he ensure that there are no drug shortages, particularly of medicines like insulin, which is not produced in the UK?
Yes, there's a huge amount of work underway to make sure that we are fully prepared for all eventualities this winter, and it's an important piece of work right across the department.
Final question, Anne-Marie Trevelyan.
Thank you, Mr. Speaker. I'd like to thank the Secretary of State for his commitment to Northumberland hospital investment with the Northgate hospital investment announced last week. But to ask him that the important factor that going forwards, rural hospitals like Berwick Infirmary, one of the most rurally placed UK English hospitals, is absolutely placed to develop the technology that we can use so that we can reach many, many more patients without them having to travel a long distance to get to hospital.
Mr. Speaker, we've ended where we started this question session with my delight at a new hospital that's been funded and announced by the Prime Minister on Friday, Newgate in Northumberland. It's a very important development. But my right honourable friend makes an important wider point, which is community hospitals are so important, local to where people live, and with modern advances of technology, we can deliver more services closer to people's homes, in people's homes, and then in community hospitals, as well as, of course, needing to build those superb hubs of science and care that our great hospitals are.
In order to allow the safe exit of honourable members participating in this item of business and the safe arrival of those participating in the next, I'm suspending the House for 3 minutes. Order!